First got into art when I was maybe in fourth grade. I took a colored pencil class because I really liked drawing. Um, so I did that for a couple of years, and my goal was to get into oil painting, but I quit the class before I could start oil painting because you had to be in seventh grade in order to start painting. So I kind of quit, and then I reconnected with my art teacher. Her daughter was having surgery here many years later, and I found out, and so I went to see her, and she had moved downtown, and I told her, I wish that I could have started painting, and she said, well, I'm starting a semi-private oil painting class. Do you want to join? I said, yeah, of course. So that's kind of how I got into it, actually kind of quick. I saw a picture that my boyfriend Joel had taken on the beach, and I was just so attracted to it because of the colors. Here it is, this peaceful beach, nobody's on it, with this bright yellow and red umbrella, and it's about to rain. And it just stuck out to me. It was actually a favorite picture of his mom's. He took this photo and she loved it. So what I decided to do was recreate it, repaint it, and I gave it to her for Christmas. So it took me probably about, I would say maybe 6 weeks, because the class is only once a week. So you have 2 hours. So I would say, it probably took me about 6 times. Yeah, I like texture. I kind of like to make something more, I guess, three-dimensional, 2 and 3 dimensional. So I took ground up pumice stone and I mixed it in with the paint to give the sand a texture. I always wanted to be some kind of therapist. I wanted to work in a hospital. I wasn't sure at the time when I was in high school, but I started volunteering and just got interested in, what PT and OT did. And, I pursued it after in graduate school because the college I went to didn't offer occupational therapy. So I actually became a recreation therapist first and then proceeded to get my master's in occupational therapy. So I work in the outpatient clinic at Rush, and I primarily work with patients who have breast cancer or have breast cancer related lymphedema. So I guess some frameworks that I incorporate into my daily work is I take more of a holistic approach. I like to look at the whole person. That's really important to me because these people are very vulnerable after what they're going through. I also value the biomechanical approach because, the patients come in and most of the time, due to mastectomy, they've got postural dysfunctions, decreased upper extremity range of motion. They complain of difficulties with putting a t-shirt on overhead or reaching behind their back to don a bra, those kinds of functional impairments. And so the biomechanical approach is very important because we work on stretching and soft tissue mobilization and range of motion so that they can get back to doing, activities of daily living. OT and art are similar to me because, I'm creative in some ways. I'm creative, but for me, I like to be hands-on, and I like to create something or make something beautiful or better. And with oil paintings, you can certainly do that and be creative. As far as working with patients, I just want to, it's kind of what I do is somewhat intimate. So you have to be, I don't know, you have to have a way with people, and um, I like to touch the patient. I think that tells a story, just like your oil painting can tell a story. So I feel like when I can touch a patient, I know maybe where they're having some tightness or some kind of restriction, and we can kind of move forward once I can help them move past that.